Okay, welcome. I'm going to go ahead and call this meeting to order. Welcome to the House Standing Committee on Health Services. We have a lot of folks here today, and I want to welcome a few guests, but first we are going to go ahead and have DJ take the roll.
Representative Bentley. Yes. Representative Bratcher. Representative Bray. Representative Burke. Representative Callaway. Representative Camuel.
Here.
Representative Duval.
Here.
Representative Frazier Gordon. Representative Justice. Representative Neighbors.
Here.
Representative Rayburn. Representative Raymer.
Here.
Representative Riley. Here. Representative Rourks.
Here.
Representative Sharp.
Present.
Representative Wilner.
Here.
Representative Whidden.
Here.
Vice Chair Dotson.
Present.
Chair Mosier.
I'm here. Okay, we have a quorum established to do business, and again, just welcome to everyone. I see that there's some folks standing, so if you want to find chairs, I'm sure that no one will mind if you walk in front of them to do that. I'd like to welcome a few guests. As I said, today we have with us some folks from the Kentucky Birth Coalition, so thank you for being here. If you can just wave your hands, thank you for being here. And then I think we are going to have some Eastern Kentucky University nursing students join us. I just invited them to come over and take a peek in here and learn about how the committees work and do business. So welcome if we have any of the nursing students here at this point. And then last but not least, we have a friend of mine, Mr. Ron Washington. He is the incoming, soon-to-be mayor of Covington, Kentucky. So welcome. Thanks for being here. Do we have any other members with guests? Okay. All right. Well, we will go ahead and get started. I would like to allow Representative Frazier Gordon to introduce herself for the record and proceed on the presentation of House Bill 52.
Thank you, Chair Lady. I'm Representative Deanna Frazier Gordon, House District 81, located in Madison
Will you
County.
move your microphone just a little closer?
Okay.
Thank you.
Is that better? Okay. I do have a committee substitute that makes the following changes to House Bill 52. It clarifies coverage.
We have a motion on the sub and a second. All in favor of adopting the sub, please say aye. Aye. Any opposed? Okay, thank you. Please proceed.
Thank you. The sub clarifies coverage provisions for preventative screening or procedure, inserts some clinical practice guidelines by specialty group, and also applies the provisions discussed in the bill only to comprehensive health insurance plans. So,
okay. We have a motion on the bill and a second. Do we have any discussion? Okay, seeing none. DJ, please take the roll.
Representative Bentley.
Yes.
Representative Bratcher. Representative Bray. Yes. Representative Burke. Representative Callaway. Here. Representative Camuel.
yes.
Representative Dotson.
Yes.
Representative Duval.
Yes.
Representative Frazier Gordon.
Yes.
Representative Justice. Representative Neighbors.
Yes.
Representative Rayburn. Representative Raymer.
Yes.
Representative Riley.
Yes.
Representative Rourks.
Yes.
Representative Sharp.
Aye.
Representative Wilner.
Yes.
Representative Whidden.
Yes.
Chair Mosier.
Yes. Okay. Okay. House Bill 52, as amended by the committee sub, passes unanimously with 15 yes votes. Congratulations. The same should pass on the House floor.
Thank you, members.
I will make my way to the table now to present House Bill 10, and I invite any of my co-presenters to make their way to the table, and I will hand the gavel over to my vice chair.
Representative Callaway.
I'm not sure if I need to record the yes or the I'm here, but one or the other, whatever's missing, but a yes vote for that last bill.
We got you.
Thank you.
All right. Representative Mosier, if you would, you and your guest introduce yourself and proceed with the bill.
Thank you so much. Thank you, Mr. Chair. Thank you, members of the committee, for this opportunity to present a bill that we have worked on through the summer, and with a large bipartisan, bicameral working group, did a lot of research on maternal mortality in Kentucky. I am Representative Kim Mosier. I represent the 64th District, and I'll ask my co-presenter to introduce herself.
Great. Thank you very much. I appreciate the opportunity to present. I'm Representative Nancy Tate, and I represent District 27.
Okay, thank you. I think most folks are familiar with this bill. We've talked about it during the interim, and we've had opportunities to talk about it during the session in the press. And I just want to briefly talk about the reason for this. According to the CDC, Kentucky has the second highest maternal mortality or rate of death in the first year following a childbirth in the nation. The initiatives in this legislation address areas of high concern that were determined during the researching of all of the data and really trying to understand what was going on in Kentucky with our maternal mortality. Why are these numbers so high, and what can we do about it? And so those initiatives that are included in this legislation will address the high rate of substance use disorders, which are now the #1 reason that Kentucky women die in the first year following childbirth. A lack of access to prenatal care, a lack of access to mental health treatment, a lack of education, and this also provides a referral to service, including treatment, support, and follow-up care. Before I get too far into the bill, we do have a committee sub, if I could ask for adoption.
Got a motion by Representative Sharp. Who's second? Representative Bray seconds. All in favor say aye. Aye. Committee sub is adopted.
Thank you. Okay. So this legislation accounts for all of these things, and I'll kind of walk through exactly what we're doing. But it builds on legislation which was passed in 2022, which expanded Medicaid for the 12-month postpartum period, which is making a huge difference in allowing women to build a continuum of care in that year following birth. So I just wanted to mention that. In this bill, Section 1 establishes a Kentucky Maternal Psychiatric Access Program, and it'll be called the Kentucky Lifeline for Moms. It establishes a hotline which will be operated out of the cabinet. A psychiatrist and a psychologist will be hired to answer calls from an OBGYN or a primary care physician, someone who is caring for a pregnant mother who might have a mental health need. And this extends through postpartum care as well. Kentucky, I should mention, applied for a grant from HRSA and received $750,000 already to implement this program. So this is well underway. We just wanted to codify this and make sure that this is something long-lasting for moms. Section 2 is really outlining the collaborative panel and the membership on that panel. And the committee sub adds 2 additional members, one from the Department of Public Health and one from a representative from local health departments. We felt like in the education space that it was important to have these members as well. This maternal health collaborative, it's actually a maternal infant health collaborative, will oversee the Lifeline for Moms Psychiatric Access Program, and also includes stakeholders from around the state, really, who deal with maternal health and make recommendations for future policy changes, or just collecting data and making sure that we're paying attention to what's happening in Kentucky. Section 3 amends and expands the Health Access Nurturing Development Services, or the HANDS program, and this will require the HANDS program to provide lactation counseling and education about the importance of breastfeeding, support for breastfeeding, and also requires the HANDS program to provide information on safe sleep for babies. This was a recommendation that came out of the Child Fatality and Near Fatality Review Panel. It codifies new regulatory language to specify that participants in the HANDS program can also participate via telehealth if they need to. So those services can be provided through telehealth. Section 4 creates a new section of KRS 30417A related to a special enrollment period for pregnancy. We discovered that pregnancy was not considered a qualifying life event for some insurance, and we just want to close that gap and make sure that moms can get the prenatal care that they need. That's the period of time when we know that any chronic disease or any health issue is picked up and can more easily be dealt with during the prenatal care, avoiding any complications during the birth process, and certainly has a healthier, we have a healthier outcome for the babies. We're looking at, of course, healthy babies, reducing neonatal intensive care stays, and all of the areas of concern around the birth process. And then lastly, the Cabinet for Health and Family Services in the primary part of the bill will study doula certification and whether or not that's a valuable service, and if it's something that on a state level we should look at. The committee sub, I said, added the 2 members of the maternal to the collaborative. It also changes the phrase pregnant individual to pregnant women because pregnant women are who we're talking about. It also adds remote patient monitoring as a billable service for prenatal care through the telehealth statute, and this will allow things like remote ultrasound if it's needed, and just allows the cabinet to add these as billable services. It also adds in-home addiction treatment as a billable service because we know that moms are dealing with substance use disorders at a high rate. So I will invite Nancy to make a few comments, and then we will entertain any questions.
Thank you very much. I appreciate the opportunity and Chair Mosier's dedication to this initiative. I know several of you have heard me refer to the maternal mortality report in the past. And when you look at that, 89% of the mortalities could actually be preventable, and 54 are actually related to substance use disorder. There's an opportunity for us to, think that if people would just do what they're supposed to do, that we wouldn't have this issue. One of the things that we discovered as we were going through this investigation is there's actually a lot of things that we can do, as Chair Mosier just talked about. Several years ago, I was a member on the board of United Way of Central Kentucky, and we had this roundtable discussion regarding all the reasons why people in our region weren't seeking employment. And the interesting thing is that we found that the number one issue was obviously access to life-sustaining jobs. But then you go down to access to education for those jobs, transportation, child care, and then continuous benefits. When you compare that to what we're actually talking about, it's almost exactly a 1-for-1 ratio of the issues that are preventing women from accessing quality health care for healthy outcomes for themselves and their babies. And it's access to quality health care. It's education regarding the need for prenatal health care. It's transportation, child care, and then the expansions that we just talked about for the remote monitoring, fetal monitoring, and I think that it's this, and the HANDS program, the expansion of the HANDS program. So I'm really excited about this and to assist women to make sure that they have good quality health care and good outcomes. Thank you.
Any member of the committee have any questions? Representative Wilner.
Thank you very much. Thank you for this excellent bill. And it was great to be able to participate with you, both of you and many others over the interim on this work. And I hate to slow things down because I'm so eager for this to just become law, but I wonder if you could maybe just talk us through briefly the changes from the committee side.
Yes, sure. Those were the changes that I mentioned about adding 2 additional members to the Maternal Infant Health Collaborative. That would be the representative from the Department of Public Health and the local health departments. It also will change pregnant individual to pregnant women, and it adds remote patient monitoring.
Thank you.
Yes, of course.
If I may, I would just like to add, too, that this remote fetal monitoring is actually pretty much state-of-the-art. There's only 7 states that have introduced this, and there's 5 states that have introduced, and potentially 7 that'll be introducing this year. So this is good for Kentucky.
Any other questions? Representative Bentley?
Thank you, Mr. Chairman. Kim defined remote ultrasound. You just said it a minute ago. How's that work?
So there are some programs available now that have expanded technology and allow for remote ultrasound, remote patient non-stress test, and just to, I guess, work with at-risk moms, anyone who has potential situation or problem, condition that needs to be monitored.
Follow-up question?
Yes, sir.
If you run into one of those people that sell that, tell them to call me. I'd like to see the physics of it.
Okay.
Okay.
I can make that connection.
Okay.
Yes.
Thank you, Ms. Chairman and Mr. Chairman.
You're welcome.
Of course.
Representative Rourke?
Thank you, Mr. Chair. I would like to ask a question. You mentioned that in the committee sub, we're changing language from pregnant individual to pregnant woman. I'm wondering who that would then exclude from the bill, and if that causes concern that we are then not accommodating the medical needs that all people might experience when finding themselves pregnant.
Well, I mean, at this point in time, women are the only persons who can conceive and carry a pregnancy to term. And in terms of dealing with families, that would be the expansion of the HANDS program to deal with all family matters and provide those supports. I would say that the Lifeline for Moms is also available for situations surrounding the mom, so family situations.
One brief follow-up. Just a brief follow-up. I wanted to ask, is there any issue with anyone that maybe would have a gender marker of a different sex that then could find themselves pregnant? Is that an issue that could arise?
I don't see it that way. I see that if that's something that becomes a possibility, they would become a woman, right? I mean, I'm not going to get into that conversation about how that happens, but I think that this bill would then cover anyone who is carrying a pregnancy.
Yeah, that was why I asked. I just want to make sure anyone who finds themselves pregnant would still be covered based on the language in the bill. That's all.
If they're a woman, right.
Thank you. Representative Bray?
Thank you, Mr. Chairman. So do we know if DOI has flagged this as a defrayal or not?
I have not seen it be marked as a cost defrayal to the state. There are some questions around the insurance piece, and we're working with the health plans to maybe come up with a floor amendment to really target who is able to provide this open enrollment. And I mean, we have the actuarial statements, we have the health mandates, which we can talk about. It doesn't substantially raise the rates. I think it was 0 to 1.42 per member per month, possibly.
Yeah.
We don't really know what the number of women who find themselves pregnant who don't have coverage will be. But we just want to close this gap and make sure that everyone can get the prenatal care. But no, in answer to your question directly, no.
Okay, thank you.
Be any other questions? Seeing none, DJ, take the roll. Oh, I need to get a motion. I get a motion. First and second, Bentley.
Representative Bentley. Yes. Representative Bratcher.
Yes.
Representative Bray.
Explain my vote, please. I'm going to pass today. I am curious about the DOI defrayal and the possible floor amendment. Thank you.
Representative Burke. Representative Callaway.
Yes.
Representative Camuel.
Yes.
Representative Dotson.
Yes.
Representative Duval.
Yes.
Representative Frazier Gordon. Representative Justice. Representative Neighbors.
Yes.
Representative Rayburn.
Pass.
Representative Raymer.
Yes.
Representative Riley. Representative Rorks.
Yes.
Representative Sharp.
Aye.
Representative Wilner.
Yes.
Representative Whitten.
Yes.
Chair Mosier.
Yes.
I have also Representative Bratcher just came in, so.
Yes, I'd like to put down an attendance vote that I'm here, and then also on House Bill 52, a yes vote.
Representative Rayburn.
I would like to record my attendance as here and then also a yes vote on House Bill 52. Thank you.
And Mr. Chairman, if I may just address the issue of the cost defrayal, I'm willing to put in our floor amendment that we will require the cabinet to apply for an 1115 waiver if that becomes a situation. So, okay, thanks.
We've had 15 yes votes, 0 no votes, and 2 pass votes. And this has passed with favorable expression. I expect the same to pass on the House floor. Thank you, Representative.
Thank you.
The next bill we will hear today is House Bill 194. Rep. Mosier and your guest to the testimony table. And when you're ready to start, please state your name for the record, and you may proceed.
Okay. Thank you, Mr. Chairman. Thank you again to the committee for hanging in here with me. I am Representative Kim Mosier for the record. I represent the 64th District, and I have a guest with me, and I will allow you to introduce yourself.
Thank you, Chairwoman. I'm Jim Musser. I'm the Senior Vice President for Policy and Government Relations with the Kentucky Hospital Association.
Okay. Thank you. House Bill 194 is really a simple bill, but it'll make a big impact on behalf of our healthcare workers and safety provisions within a hospital or an affiliated hospital satellite, I guess, is the best term. We do have a committee sub, and I would just, thank you.
Motion first on Representative Sharp, second with Bray. Representative Bray. All in favor say aye. Aye. Committee sub is adopted.
Okay, thank you. What this bill does is adds a person who is under contract with the hospital, so that could be a visiting nurse or an employee who is not a full-time employee but is working at the hospital, to have the same protections against violence in the healthcare workplace as any other healthcare worker. The committee sub simply adds the word affiliated, and that just allows any hospital satellite or clinic who is part of the hospital system to also be covered under this provision. And I think Mr. Musser has a few comments, so I invite you to just expound upon the need for this bill.
Thank you, Chairwoman Mosier, and thank you, committee, for having me here today. It's always a pleasure to be with you, because I feel like when I talk with this committee, I was talking with Representative Tate prior to the meeting starting. It's so nice working with this particular committee because you are very oriented toward finding solutions to problems, and we appreciate that so very much. You're always great partners in the health of our people, and that really is the touchstone for us. It's the health of our people. Chairwoman Mosier and I first discussed this issue several years ago. It's been sadly a growing problem in our hospitals, and it's reached the point that we really do need legislation in order to address it. I normally speak to you about how the legislation is going to have an impact on our patients, and it's true in this case as well, but you really have to be cognizant of our healthcare heroes and what they need, because without them we're not able to serve the patients. And we live in a state where Kentucky currently has a workforce shortage in healthcare. Our hospitals have 13,000 unfilled positions. Nearly half of those are our nurses. We can't do things that endanger them and make it a disincentive to be in our hospital. So I just want to thank Chairwoman Mosier for bringing this. This really is critical. It's a simple bill, but it's a critical piece of legislation to protect those dedicated, knowledgeable, and compassionate people in our hospitals that we're all going to be relying on at some point. The violence against our nurses, our doctors, our therapists, and the rest of the healthcare teammates has grown exponentially from abusive language, which is bad enough, but it's spitting and hitting and shoving and threats with weapons. And so this legislation really does take a step in the right direction toward providing the kind of protection that they need. If we're going to live in a civilized society, we certainly have to be really working every day to protect those who are on the front lines of restoring health and saving lives. The bill is so important. None of us can afford to maintain the dangerous situation that we have in our hospitals right now. And everybody thinks of it in terms of the ER, but it's not just in the emergency room. It's all over the hospital. Even in labor and delivery, we've had attacks on nurses, doctors, therapists right there in labor and delivery. And we can't continue that way. It's the right thing to do to protect our staff, and it's critical to protect them to make sure that our patients have the care that they need when they need it.
Bill?
Second.
I got a motion on who made the first? Got a motion and a second. DJ, call a roll.
Representative Bentley,
Yes, I'll explain my vote.
Go ahead.
In my 50 years in the healthcare profession, I've had people aggressively on PSP, and when you're on PSP, they almost kill you. And I think this is a good idea. Thank you both for bringing it forward. And like you say, Mr. Vice President of the Kentucky Hospital Association, it's getting worse on the floor. Thank you for presenting this bill.
Thank you, sir.
Representative Bratcher,
Yes, explain my vote. I had to go to the emergency room at University of Louisville a couple years ago, and it was around 11 o'clock at night until 1 in the morning, and there were people in there threatening the doctors, threatening the nurses with violence, demanding drugs. The police were in there, and that was an eye-opener for me of what these medical professionals have to go through, and they shouldn't have to endure anything like that. And it just so happened that the person that was treating me was a contracted doctor. So I fully understand and support this. I have a yes today.
Representative Bray,
Yes, explain my vote. I do vote yes. Thank you all so much for this. I know back home personally, I've seen the steps my own hospitals had to go through with hiring additional security, with additional training, and it is a huge, huge issue that's not talked about enough. So thank you all.
Representative Burke, Representative Callaway,
Yes, explain my vote, please. As somebody who represents a portion of Louisville, I too thank you and will be voting yes today.
Representative Camuel,
Yes, thank you for this.
Thank you.
Representative Dotson,
Yes.
Representative Duval, Yes. Representative Frazier Gordon, Representative Justice, Representative Neighbors,
Yes.
Representative Rayburn,
May I explain my vote, please? I'm going to be a yes today, but I do have a couple of questions that I'll get with the bill sponsor on. Thank you.
Representative Raymer,
Yes.
Representative Riley,
Yes, and I'd like to explain my vote. I think this is great. I'd like to see it expanded to doctor's offices, dental offices, physical therapist offices, anything that deals with the medical profession. I think they should be protected just as well there as they are at the hospitals. Thank you.
Representative Rourke,
Yes, and I'd like to explain my vote. As the bill, is just expanding where the location would be, and that these protections are in place, I am supportive.
Representative Sharp, Representative Wilner,
Yes, and I'd like to briefly explain my vote. Thank you. So I'm normally philosophically opposed to expanding definitions of crime, but literally our healthcare provider shortage is one of the things that keeps me awake at night. And anything that we can do to protect our healthcare providers, I'm for it. So I'm a strong yes on this. Thank you.
Thank you.
Representative Witten,
Yes.
Chair Mosier.
Yes.
17. We have a unanimous yes vote, 17-0. The same should pass on the House floor. Thank you, Representative Mosier. Our next scheduled meeting will be the House Standing Committee on Health Service Thursday, February the 15th. Do I get a motion for adjournment? Had to do it.